joints. So the action of those skeletal muscles on the levers of the bones produce movement, especially in synovial joints. It's going to be relative to a fixed end of the skeletal muscle. That's a part of the muscle that's on a bone that is not going to move, called the origin. And then the other side of the muscle is connected to a bone that will move, and that is called the insertion. And movement at a joint will occur when a muscle contracts, gets forcibly shorter, and its fibers will pull the insertion toward the origin. It's an important fact to remember, that you have to account for all possible movements by pulling on something. The only movement a muscle can do is pull. So some types of movement we have are abduction and adduction, shown here. You abduct, it's moving away. Adduct, moving toward. Flexion, extension, and hyperextension. Flexion is lifting away. Extension, bringing the arm back. And hyperextension is going beyond the normal angle. That is not always a bad thing, although we often hear of someone hyperextending a joint that's not supposed to be hyperextended. There are also cases where some joints are meant to be hyperextended beyond 180 degrees. And we also have lateral flexion and extension. Dorsiflexion and plantar flexion involve the foot. Circumduction and rotation, exemplified by the shoulder. Medial rotation, lateral rotation, and supination and pronation. Remember, supination and pronation in the forearm are going to change the position of the ends of the radius and the ulna. Inversion and eversion. Protraction is to extend out, retraction is to bring back, and elevation and depression we can do with our shoulders, for example. Okay, and I'm going to stop there, and then next we'll talk about some specific synovial joints.